Hello everyone, I'm Tammy Huynh, and today I'm talking about the environmental determinants that contributed to the spread of Ebola in West Africa. First, highly mobile populations. Second, damaged public health system. And third, cultural beliefs and practices. First, highly mobile populations. In Guinea, Liberia, Sierra Leone, many people migrate and immigrate between these country borders, which make cross-border tracings extremely difficult. In addition, when one country Ebola situation improves, more people from neighbor country come over to seek treatments, therefore reignite the transmission chain. As you can see, many places that got infected are around the borders, which is around 500 to 4,000 confirmed cases by World Health Organization's December 2015. Second, the damaged public health system. Economically, Guinea, Liberia, and Sierra Leone are among the poorest in the world due to the long years of civil war. The civil war also leads to young generations without educations, which make it harder for them to generate a good source of income. Due to the bad economy, communication system, transportation system are also weak, which delay transportation of patients to treatment center and sample to laboratories. The communication of alert, report, calls for help, and public information campaign. There also a shortage of health workers. According to the World Health Organization, prior to the outbreak, the three countries had a ratio of only 1 to 2 doctors per nearly 100,000 populations, and the outbreak further reduced the number of health workers. Lastly, cultural beliefs and practices. They have traditional funeral and burial practices. There is number of secret society. Some mourner bathe with each other with rinse water from the washing the corpses. They also sleep with infectious corpses, and with the belief that the power would transfer from the dead to them. Many Ebola patients also rely more on traditional healers and self-medications, which are not reported because they do not go to clinic and hospital, make it hard to record, contain, and treat Ebola patient properly. According to the Guinea Ministry of Health, 60% of cases in that country could be linked to traditional burial and funeral practices. And in Sierra Leone, estimate 80% of the cases in that country were linked to these practices. Why we deserve $100 million? Because Ebola is an epidemic. We have extensive research on Ebola epidemic, even though there's a need for more research on how to contain the problem, how to rebuild the public health structure in infected countries. We also understand the cultural beliefs and practices that they are very sensitive with what we tell them to do. There need to be more epidemiologists with extensive knowledge in outbreak containment to go out and support the surveillance of Ebola, contact tracing, data management, laboratory testing, and health educations. Thank you.